A big round of applause, please. Now, ladies and gentlemen, we'll be witnessing the lamp lighting ceremony. I welcome Professor Arun Kumar Agrawal sir and Professor Sonu to please come on the stage and illuminate the light for mitigating the darkness. I request, yeah, one of the participants can also join. Any one of you? Thank you very much. So this lamp symbolizes the light of divinity, wisdom, intellect, and good work. Thus, this lighting brings us hope of protection against ignorance and bring positive thoughts amongst us to fight the negativity. With this, now we'll move ahead, and I would request my program director, Professor Sonu Goyal, to welcome the audience and share the program overview. So Professor Sonu is a medical doctor with MD in community medicine with 18 years of experience, and he's a fellow of IPHA and various other organizations. He's an alumnus of John Hopkins School of Public Health, Baltimore, Maastricht University, and he's also adjunct faculty of two of the leading universities, University of Limerick, Ireland, and Swansea University, United Kingdom. He's also a director of E-Resource Center for Tobacco Control, E-Learning for Public Health, and of course this particular program. I welcome you, sir, and I request you to briefly give the program overview, followed by a video.
A very good morning to all friends from different countries. So first of all, I extend my wishes to Professor Arun Kumar Agrawal, our head of the department in Department of Community Medicine and School of Public Health, who has always been very supportive in conducting these programs, not only this program, but other programs conducted by various faculty in our department. So, this is, as Dr. Kritika has said, we have already conducted 22 IPH-MDP earlier, and this is the 23rd International Public Health Management Development Program. So we started this journey in 2016, and now this journey is going on, and we have many phases in this journey. This is the 6th phase of the journey, and through a small video, I'll be describing these 6 phases, how this journey has evolved over a period of time. So there are 3 reasons why this program being conducted in Chandigarh, being conducted in PGI, is one of the unique program. The first is this Chandigarh is known as City Beautiful. I think that many of you who have come from different countries, I have seen many from South American countries as well. So they might have Googled that what Chandigarh is. So Chandigarh is also known as City Beautiful. So in this entire country, which is the second largest country of the globe, Chandigarh is the only city beautiful with lot of parks, lot of greenery, and lot of positive vibes. Second aspect is PGI. PGI Chandigarh, PGI among 800 odd medical institutes of the country, PGI is often rated as either second or first in the entire country. So our institute, Postgraduate Institute of Medical Education and Research, is one of the highly reputed institutes of the country. And we, Department of Community Medicine and School of Public Health, belongs to that institute. And that has also got a long history. And the third important point is this program, which was conceptualized way back in 2016, is sustaining itself with the love and the participation of the participants from different countries in last 7-8 years. And it is ever growing. We have been receiving every time we received more application than it is desired in this program. And we categorically select not more than 30 participants because of the fact that we have some sort of, if we have this cohort, we can have a lot of interaction among this cohort rather than having a big conference or big meeting. So that was these are the three things which I wanted to share with you. I normally describe this program, but we have made a small film through which you will know more about this program, how this program has evolved over a period of time. So I wish you all the best in this program. You will not be only having the technical aspects in this program. There are multiple more aspects which we all will be learning together in this program. Thank you.
Thank you very much, sir. And I would like to show you the IPH MDP journey through a video.
In this constantly changing world, 10.6 million individuals were affected by tuberculosis in 2021, representing a 4.5% increase compared to 2020. The number of people living with HIV reached 38.4 million in 2021, a significant rise from 30.8 million in 2010. Malaria cases continue to rise, and the global tally of cases stood at 247 million in 2021, with an increase of 13 million cases from the year 2019. Additionally, the COVID-19 pandemic claimed 6 million lives worldwide. 45% of deaths among children under 5 years old are attributed to undernutrition. 1.62 billion people are suffering from disabilities caused due to non-communicable diseases in 2019, an increase from 43.2% in 1990 to 63.8% of total disabilities in 2019. While the developing nations are still struggling with infectious diseases, NCD burden continued to rise. All of these disturbing numbers are on rise due to the suboptimal functioning of health system. For strengthening health system, World Health Organization has given 6 building blocks, where the leadership and governance building block cuts across all the sectors of healthcare. Leadership training among healthcare workers helps them to work efficiently in finite resource setting. The management of COVID-19 pandemic across the world has shown us that healthcare professionals were not well trained in managing the crisis. countries with good leadership and governance fared well during the COVID times. The existing trainings are theoretical, not contextual to LMIC, and have a huge cost. Thus, a need for leadership and management training for healthcare workers was established.
Looking at the need of public health management and leadership, I conceptualized this International Public Health Management Development Program way back in 2016. Initially, it was a challenge for me because people were not aware about the importance of leadership in public health. But I took this as a challenge, and then we initiated this International Public Health Management Development Program, which was a huge success, and we could enroll 1,000 plus international delegates from across 85 countries in 6 years.
The program was established with the objective to enable the participants to build capacity of middle and senior managers in designing, implementing, monitoring, and evaluating program and project operations, and to equip participants on appreciating gaps in the current scenarios and envisioning future trends in healthcare management for effective decision-making. Our call for the first course in 2016 received a great response, even though it was self-sponsored by the participants themselves. 100 plus nominations were received, and we selected 36 participants from 15 states of India, which included 5 head of department from leading institute AIMS. One of the alumni of the first course was selected as a director of cultural relations in Peru. He went there and convinced the ambassador of India in Peru to conduct a similar course in Peru, but it had to be conducted in Spanish. And with the call, the program got an international platform in 2017. Consequently, a flagship program of the Ministry of External Affairs and International Technical Economic Cooperation was set up. Therefore, IPHMDP established a second milestone. Officials from the Ministry of External Affairs approached us to involve the senior level or policy level managers, so that middle level managers trained under IPHMDP shall work harmoniously with senior level or policy level managers to fortify the health system. Subsequently, a course in public health policy and management was added to strengthen the senior cadre. Hence, third milestone in the journey of IPHMDP was laid down. These are the few glimpses of IPHMDP courses over the years. Observing the best practices of the international delegates, we realized that an exposure to international practices to strengthen the Indian health system is needed. Following that, we engaged with the National Health Mission of various states and proposed the idea of conducting a course for senior policymakers and program implementers, where they can learn good health system strengthening practices from neighboring countries and replicate them in their jurisdiction and states, where they could learn valuable best practices from neighboring countries that have developed unique and replicable public health approaches. This idea led to the creation of an executive leadership program for NHM officials. Even during COVID-19, when everything stood still, our learning remained uninterrupted as we launched online program under the broader umbrella of IPHMDP. This marked a significant milestone for international program for Health Management and Leadership Development Program, IPHMDP, as we ventured into the realm of online education for public health. In response to a request from the Ministry of External Affairs, we expanded our online course offerings to include diverse domains of public health management, allowing public health management professionals to enhance their knowledge in areas such as supply chain management, health system strengthening, and quality management. Besides weekly courses, we have launched courses for the duration of 3 months and 6 months. With our program's expanding reach spanning over 85 countries in less than 7 years of inception, the demand for country-specific courses from our alumni continued to grow, leading to the 6th phase of the International Program for Health Management and Leadership Development Program, IPHMDP. These courses are designed to address the need and demand and specific health system-related challenges faced by different countries, fosters the development of marketing abilities, strengthens collaborative network for cross-functional projects, effectively address future challenges within their organization through best practices and innovative strategies. Here are a few testimonials from our alumni.
Good day. My name is Emil Iskandar. I'm from Baku, Azerbaijan. I'm head of the Division of Emergency Medical Services. IPH MDP's use of gamification is simple, brilliant, and has been a game changer in my career. I can't recommend IPH MDP's gamified courses enough. Thank you very much.
IPH MDP's adult teaching pedagogy is truly exceptional. Their innovative approach blends experiential learning, practical application, and personalized mentorship, creating a transformative educational experience. I highly recommend IPH MDP for anyone seeking to enhance their professional skills and advance their careers in the most engaging and effective way possible.
Good morning, everyone. I just want to say that IPH and IMDP's use of gamification is simply brilliant and has been game changers in my career. They have transformed the learning process into an exciting adventure, and I really have to say it is incredible how the challenging approach keeps me hooked and motivates even beyond the course and makes complex concepts easier. I can recommend IPH MDP's gamified course enough. Thank you, and I hope to see you soon again.
The target audience for this group are doctor, nurses, middle-level managers, senior policymakers, public health professionals. The impact of our IPH-MDP program has expanded to more than 85 countries, resulting in the formation of a global IPH-MDP community consisting of over 1,050 participants and a resource faculty alumni group of 100 plus. Additionally, we have successfully trained 620 participants through our online platform.
International Public Health Management Development Program stands out in developing leadership and management skills in senior level managers across the globe. It has a unique pedagogy of learning with fun. We use gamification approach to enhance learning of senior managers. This not only inculcates interest among global audience, but also it is immensely useful for improving the sustainable development goals and increasing universal health coverage across country, which will help in strengthening health system of developing nations across the globe.
As IPH-MDP continues to groom visionary leaders and nurtures the potential of aspiring changemakers, we pave the way for a brighter tomorrow, where a new generation of public health leaders will shape the future of global well-being. IPH-MDP Building Future Leaders.
So this was a brief glimpse of IPH MDP, and now you are part of this family, and definitely you are going to experience the teaching pedagogy which we have talked in this particular video, and definitely you're going to have a great experience. So thank you, Professor Sonu, and we'll go ahead with welcoming again. This is the cohort of fourth PHPM. You can see your picture over the screens. And this is the organizing committee, me, Dr. Nandita, and Dr. Diksha. Now I take the honor to welcome our chief guest for the day, Professor Arun Kumar Agrawal, sir. Like I have told you, he is the lead of our department, and his areas of interest include reproductive health, child health, quality of care, micronutrient deficiency diseases, operational research, implementation research, health system research. And he's, let me tell you that he's looking after the department. Along with that, he's looking after various projects, out of which he is leading a challenging project in 10 high priority districts of Haryana, which is one of the states of India, and where he's getting 2 priority programs implemented, IMNCI and IDR, MDR, SB review, and the project aims to improve the health system and promoting data usage by the district officials. And let me tell you that he has published more than 100 articles in international and national journals and written various chapters in the book, including the recent Management of Health Systems by Oxford Publishers. So I welcome you, sir, and it's my honor to have you here. I hand over the stage to you.
Good morning, namaskar everyone, and once again welcome to City Beautiful. As has been illustrated very nicely by Professor Sonu Goyal, the journey of this particular program, and also that why this program is needed and how this program was useful to the previous participants, as was shown by some testimonials. These are all wonderful things, and I hope that your orientation, experience and interaction in this program would be professionally beneficial to you in terms of learning and practicing some concepts. Management is not a rocket science. This is science and art. And generally these things are there in everyone. In your own families also, your parents, your mother, they are one of the best managers. But actually they can practice themselves. It is difficult for them to train others to replicate it. So when you go through such programs, you understand the theories behind those things which you are already doing. You also understand the importance, how important this is. So that is the beauty of such workshops, where you interact with people and practice those concepts which were already known to you. So management is science and art. Art is generally in terms of all these soft skills. I'm told that all of you are senior officials. It means that you are managing your organizations in some capacity, and there are some staff below you, and you have to manage the human resources. And when you manage the human resources, it is a common problem, especially in the developing countries, that people don't want to work. You have to motivate them, you have to get the work done by this way or that way. All those soft skills, how to manage human resources, how to manage conflict, how to have communication, all these are soft skills. Those soft skills can be practiced. So these workshops give that platform how to practice those soft skills also. And one important myth is that it is said leaders are born. Okay, so leaders are born, that is true, but 90% of the time leaders can be made. And it is here in such type of platforms and exposures, those who are on the boundary line to become good leaders, they will gain some skills, and they can, if they practice in their own countries, at their own workplaces, they are definitely bound to become good leaders. So from here, when you go, that you should identify that what gaps in your personality and how to bridge those gaps. And when you practice those gaps, definitely you will be on the path to become good leader. And this is what is different between management and other sciences. In other sciences, for example, if you say statistics or epidemiology, it is difficult to understand that how to do data analysis using a particular software or something like that. It is difficult, but once you understand, it is very easy to apply. But in management, when soft skills are told, you feel it is so easy. When Dr. Sonu Goyal will tell you, or some faculty will tell you This is how you have to communicate so that there is no conflict and the situation is I win, you win. It will look very, very easy to you. But when you practice and someone comes in front of you, your inner self forgets those concepts which you have learned. And then you keep shouting at each other of various grades. Shouting is of also of various grades, but ultimately there is a conflict. So you can make a change in your personality by gradually practicing. Every night when you sleep and you think that today what happened, what was wrong, what was negative during the entire day, and then you recall that what concepts we had learned in this workshop, whether some of those conflicts are explainable by these concepts which I had learned. So then have a resolve in yourself that next day if the same thing happen, I will try to minimize that, if not totally reduce that. If you make a gradual self improvement, you will move towards the path of a good leader. With these few words, I wish you best, that you have the best of the opportunity available to be here, not only professionally and but to have your own recreational needs, move around in Chandigarh. It's not a good shopping place. As Dr. Sonu told in his own way, there are a lot of parks. We joke among ourselves that Chandigarh is a place of tired, retired and nearly expired people. Okay, but this is not a commercial place. This is a place to enjoy, to relax, lot of parks, you meditate. So if you want to be away from that, all that commercial zigzag, so this is a very good place to live. So people, after having their entire life lived in metros, now they are buying properties here in Chandigarh and nearby so that they can relax. So you have come from your busy lives, so have some learning. Some traditional shopping would be there, not much, but relaxation 100%. Thank you very much.